Hi, I'm Dr. John Young, Medical Director of Foundational Health Center here in Largo, Florida.
Hi, I'm Alex. I'm a nurse practitioner.
So Alex and I work together, and people come to us because when the other doctors can't get the patient better, they usually show up to our office because we really try to look outside the box to get people better, not throwing more drugs at them and things like that, but really looking at the biochemistry, the physiology, what can we do to get them better. So one of the things that I've been reading about lately is there's a drug out there, and probably a lot of you have seen it advertised on television, called Enbrel, E-N-B-R-E-L. And it's used for psoriatic arthritis. You usually get a shot of this or an IV of it every week for the rest of your life. And it's made a huge difference in our psoriatic arthritis patients. But there's also been some anecdotal evidence or articles here and there talking about, one article was that it's use in autism, it's use in strokes, but there was an interesting article recently about in treating some of these patients with psoriatic arthritis that they noticed that these people also had another problem of depression. And they noticed that their depression got better. So we've kind of done some research on that. And I was just talking to Alex, and I are always having our daily meetings early in the morning. And, I was just talking to her about some of the off-label use for Enbrel. It's a one-time deal. It's not every week. And I noticed, listen, she's still young and beautiful, but she has said, going through this menopause is no fun. Of course, being a guy, I understand all of that, not. But Alex, you take it from there.
Right. So I'm 46 years old, and like a lot of you ladies know, in your 40s, things start to change, your hormones start to change, and you kind of start feeling a little different. You're like, it's like, I don't know, I'm not depressed, I'm not sad, everything's great, my life is perfect, but I kind of I don't know, where's the zest of life? It's like something is missing. So we were talking about it, and we were talking about Enbrel, and I was reading this article that he mentions about psoriatic arthritis patients, and actually it's one of the side effects. They have less depression. And one of the reasons for that was because it lowers the inflammation in the brain. One of the inflammatory markers in the brain that has been linked to depression is it's cytokines. So the Enbrel seems to lower the cytokines in the brain of some of these patients, and they get better with the psoriatic arthritis, but they also have less depression. So we were talking about that, and I was talking to my doctor, and I was suggested to do what?
So the interesting thing with Enbrel is this. You've got to get it past the blood-brain barrier, and you got to get it into the central nervous system, the spine, the brain. And you don't have to go through the spinal cord and give injections, which is a little bit dangerous. But there's the vertebral vascular system, and I've talked to a lot of doctors, and they've never heard of it. And you access it in a certain way along the spine, here in the back. You don't go anywhere near any nerves. And then you give the injection. It takes about 20 seconds.
20 seconds.
You lay them face down about a 30-degree angle, because there's no valves in that vertebral vascular system, so it goes right into the brain. And you leave them that way for 5 minutes. Then when you stand them up, it's locked in. And I'm going to mention a patient that I first did it on.
Okay.
With serious depression, and just hooked on a number of drugs and all that, was not in a good position. And we gave it to him. And I talked to him later, and he said, John, it felt like my head was coming off the top. Top of my head was coming off. No pain or anything. But when I followed up with him, and it happened over less than a few hours, completely different person. And as the wife said, this is the guy I married.
Yeah.
That was a year ago. And mentally, he's more than better. The depression, the anxiety, it's gone. And that's one of the problems we have, you know, working as an ER doctor. I get a lot of people that attempted suicide.
Right.
And so the psychiatrist would put them on an antidepressant.
Right.
And it's not like, okay, you'll be better in 4 hours. It's 4 to 6 weeks for a lot of this.
Yeah.
And this really is something.
And it's an interesting experience because I said, all right, let's do it. I want to do it. I want to get the shot. So I got the shot. So he gave it to me in my neck, in the right place. We're supposed to get it. And it's a very interesting experience because I wasn't depressed, but it almost feels like that you are, well, some of you guys probably have meditated, and it feels like in that stage of meditation where you are just happy and content and your brain's just clear and you just can think clearly and you just feel happier, you're just in a good mood. And I was very intrigued because I was like, well, why do I feel this way? You know, and so I went back to the literature and I was reading more about it. And sure enough, I mean, we know this because we work with this all day long, and we know that the brain can get inflammation even when you do all the right things. You eat well, you exercise, you sleep, but you can still have inflammation in the brain, especially if you are getting into your menopausal age, premenopausal age, where your estrogen levels are lower, so you have less estrogen in the brain. So it's hard for your brain to detoxify. So, and it's like you said, it's hard to get the stuff in the brain. Even when you take an antidepressant, by the time you have enough in the blood to get to the brain, it barely crosses the brain barrier. So it's really hard to really get it in there. But when you get it in there, like as a shot, you just feel this a good sense of well-being. And really what it is, it's not a high or anything, it's just lower the inflammation of the brain, which we actually know that one of the causes of dementia is inflammation in the brain, and it sometimes runs in the family, so there's other things that you can do. But from the preventive point of view, I think that's an option. I think that's a great thing. So I had it done. I would highly recommend it. I also do, of course, I do my bioidentical hormones already, but I still feel like that's an option.
What we found is that anytime there's something involving the central nervous system, depression, schizophrenia, Downs, autism, stroke, anything involves the central nervous system, there's inflammation. This drug stops it almost instantly.
And what's interesting that I think you said about your patient, some of the papers, some of the scientific literature on Enbrel actually mentions not only depression per se, but change in behavior. Meaning you just become this happier person. And they also did studies where the opposite is true. If they inject your brain with a lot of cytokines, which is the inflammatory protein, if they do that, then you get like in a bad mood and in bad behavior. So we know that is true for animal models, and we know that's true for humans. So that's how it's not just the depression, but the behavior aspect of.
And in our studies here at the office, we're probably running about a 70% success rate in this area. You mentioned behavior. I think of the gentleman whose wife was severely demented, and what was making it very difficult for him was that she was extremely nasty, very, very mean, very hateful. And this is not the woman he married. And just, it was very, very hard for him. And we've done some things to really help her dementia, bring some of the mind back. But the interesting thing is when we did this injection, he came back 2 days later, John, this is the woman I married. Her attitude was completely different. A nice lady, really nice. Yeah. And that has made living in a difficult situation with dementia much more livable, and has really made a huge difference. So it's interesting because this works so quickly.
It does. It works. I think for me, it worked within an hour.
Right, because I remember saying, About 3 minutes, I went and said, "You notice anything?" Nope.
Nope. Yep.
And then he came out about 15 minutes into the visit with that patient.
Yeah.
It's like
Yeah.
someone switched it
Something
on.
just switched and you're like different.
And then side effects, we don't know because Enbrel side effects are based on getting that drug every week for the rest of your life.
Right.
And it does depress the immune system. This is a one-time deal.
Yeah.
And think of it like I've had people, as an ER doctor, I wanted to give a lady bad asthma a shot of steroids. If you give her steroids, she's going to get diabetes. I said, if you're on steroids day after day after day after day for months, very likely you'll end up with diabetes. A one-time shot is not going to give you diabetes.
Yes.
And so it's been a very nice drug to use. It gives hope, it works quickly,
Yes. Yeah.
and it's something that you all might want to think about. And we're just passing on information that our patients have shared with us.
Yes.
Any last things you want to say?
I just want to say that make sure, like, understand what we're saying. We're not saying that you're going to take, like you said, this shot once a week or twice a week. That's not at all the purpose of that. We don't do that. That's not how we use this. We use it in a specific part of your spine. So you actually have to know how to give the shot and where to give the shot. You can't just get any doctor to do that because you have to be trained to do that. So you can actually get to the system in the brain that actually going to work. Otherwise, it's not going to work right.
So we hope this has been helpful, and talk to you later.